Peer workers, a shoulder to lean on, the voice of reason when you're down in the dumps.
It was like having a conversation with a friend.
She understands the complexity of mental illness and what it means to stay well. I don't know where I'd be without it, to be honest.
You know, people didn't know what peer work was. What do they do? How do they do it? And we actually often talk about it's not what a peer worker does, but it's why.
I like the fact that I wake up every day and I'm going to help someone. And more than likely, if it's an average day, I'm going to help 4 people. So that's an opportunity for me. I like being on the front line, and I've got my own lived experience. So I'm living with that, and I'm using that. It's helping me, and it's helping those that I support.
To be invited into team meetings or to be part of family action plans, to give my peer perspective has been very empowering for myself, and just I think that's all new area.
It was a new thing for everybody, having the peer worker, but she settled in beautifully and her roles kind of evolved. She's really a huge part of our multidisciplinary team. She attends our handovers, case review meetings, and does a lot of work with the young people. She's also run focus groups and things with young people and carers to help us enhance our program. And then she does individual work with young people and carers, as well as helping to inform the team.
They bring hope to the team for both staff to be able to see the recovery journey of the clients that they're working with, but also to the clients themselves and their families.
We achieve recovery in mental health when we build the autonomy and independence of the other person to navigate that. That culture of respect is crucial.
Jim has been very patient and he's listened to me. We also went through and discovered that I hadn't been on a train for 10 years, haven't been on a bus for 10 years. We've caught trains, which was a big deal. Got my Opal card. So I can sort of talk to Jim, and he's sort of in between the medical help, which helps, and the fact we could spend time just having a coffee and just talking about things in general. And he shares a bit about his life, and it started to help me to share about mine.
She sort of treated me like a normal human being, and she snuck off and got me a couple of sandwiches and a drink, and then we got talking, and then they were able to coax me back into that room where they needed to take bloods and monitor me.
Definitely she has for me. She helped me obtain housing, get my driver's licence, contact with my children. There's been a lot she's done for me in the past 12 months.
It's always good to have someone you can ring any time of the day to have a chat to if you're in distress, as well as teaching them sometimes relapse prevention skills. If the peer worker has those skills themselves, that can be a very important skill to share with other consumers.
There's a certain thing that happens when you connect with someone as a peer worker. When you talk about the fact that you understand that and your lived experience and touch on that, there's just a look that you have with them. You really feel helpful. You really feel connected, and you feel like you've got them. You've got them.
We know that peer-led, peer-supported initiatives are what works, are what people want. There's a genuine appetite for it now. Lived experience needs to be baked into the cake of mental health, of the mental health system and of mental health reform in Australia.